Good evening, Professor Martel. I am doing my final exam project on the integumentary system, and I am researching psoriasis. So the normal function of this system, well, first of all, it's the body's largest organ system. Three main layers: epidermis, dermis, hypodermis. And the physiology of the system, well, its main functions are very important for sustaining life. So it provides protection, the physical barrier against trauma, radiation, chemicals. It also provides thermoregulation and regulates temperature through sweating. It also contains sensory receptors, detect touch, pain, pressure, houses immune cells, and eliminates small amounts of waste through sweat. Vitamin D synthesis, um, where the where it's converted to vitamin D3, very important. So psoriasis is an immune disease, and what it essentially does is it speeds up skin cell production. Now, instead of somebody without psoriasis, they have a cell turnover about 21 to 28 days. Now, someone with psoriasis, those cells are turned over every 3 to 5 days. So it causes kind of a buildup, kind of a traffic jam. You could see right here of the cell buildup. And that's what causes these flaky, painful patches that could appear pretty much anywhere on your body. Psoriasis alters normal physiology, not just with your, hijacking your skin and causing these thick scales, but it also causes widespread inflammation. And we now know how bad inflammation is for pretty much all parts of our body, all tissues, and the overactive T cells in the immune system does affect different tissues. Systematic effects, joints, increase of obesity, diabetes, hypertension, not to mention mental health issues, increased depression, anxiety. Not only can it be unsightly, but it's extremely painful. Here is an illustration, kind of a microscopic level of these top sides are normal, the normal skin, and then these are psoriasis, and you could see just even at that level how it's just not affecting the layers of skin. Molecularly, psoriasis is changing things as well. You could see from this illustration, and it's the immune cells, like the T cells, their signaling pathways leading to the rapid skin cell growth and inflammation. Now, they know that it's caused by a few things: genetic predisposition, environmental. There's also specific genes, from your parents. If both parents have it, your chances of having psoriasis like goes up to like 41%. So it's pretty much just this immune system that creates a cycle of skin turnover and immune activation. Psoriasis seems to be diagnosed kind of mid-age, about 41 through 70, with 51 to 60 being the predominantly diagnosed age. But I mean, you see infants with psoriasis. It could be diagnosed pretty much any at any age. Why does it happen? Why does psoriasis happen? Well, we've discussed the immune system being kind of the culprit in it all, speeding up the skin growth, and genetics, stress, infections. What's interesting is a lot of people first notice a psoriasis patch after contracting strep, so strep throat. Also, smoking and heavy alcohol use seems to be a cause of why it happens, and dry, cold weather. They don't know exactly why it happens, but there are different treatments available. Here's a little illustration of just normal skin um, and psoriasis. You see how these thick, scaly plaques are present. So, treatment options. We have our topical treatment, which is usually what they prescribe first. Your steroids, your vitamin D, your retinoids. And the only bad thing about this is it's limited to the applied area. Also, if you have psoriasis predominantly on your face, you're not going to be able to use the steroids for long periods of time as it thins out the skin. We have UV light phototherapy. So you need to go to the doctor's office to actually get this. You can buy the equipment, but it can be expensive. Um, we have like oral medication, and these are a little more convenient with fewer side effects. But the newest kind of medical technology are these biologics, and they're injections, and they target specific parts of the immune system. They have a lot of people say they work for them. The downside is they are extremely expensive. Some people do a monthly injection, and just one injection a month could be anywhere from $10,000 to $14,000. So that brings up issues with the insurance and the insurance not wanting to cover it, so on and so forth. But the actual science behind these biologics is very interesting. So I'm going to be discussing a biologic called Tremfya. It's kind of a popular one. It's been around for a while. And it functions as an IL-23 antagonist. So IL-23 is a natural occurring protein, and it plays a huge role in body's immune response. So in psoriasis, IL-23 is overactive, and it, promotes this chronic inflammation. So Tremfya binds selectively to IL-23, which prevents it from interacting with its receptor on immune cells. So by blocking this, Tremfya inhibits the release of other pro-inflammatory substances. And this helps decrease inflammation, reduce symptoms, and it actually promotes tissue healing. Here is pictures of Tremfya use about 6 months apart in an 8-year-old child. You could see that there's a plethora of psoriasis plaques on their arm, and then after 6 months use, you could see that it's pretty much clear. So they have had a lot of success with this. But like most medications, you can't use it for predominantly long periods of time. After using it for a few years, you might have to change the dosage. You might have to try a different biologic just because our bodies become used to it. Thank you.